Welcome viewers, I am Dr. Navendu Jana, resident of Department of Internal Medicine, Tagore Hospital, Kolkata. As every year we celebrate the World Health Day on 7th of April, in view of that, we are empaneled a panel of doctors to address the various health issues that hinders the physical and mental health of a common man on the street. I'll introduce the doctors that we have on our panel. Dr. Debmalya Sanyal, Senior Consultant, Department of Endocrinology, Tagore Hospital, Kolkata. Dr. Siddhartha Mani, Senior Consultant, Department of Cardiology, Tagore Hospital, Kolkata. And on my right, Dr. Arindam Biswas, Senior Consultant, Department of Internal Medicine, Tagore Hospital, Kolkata. I'll start the discussion with Dr. Debmalya Sanyal. So the topic that we'll discuss with you is the topic of diabetes, which has become rampant in almost every household. So before going into the tits and bits of the disease, which exactly are the population that we screen for and what are the parameters that our endocrinologist looks for while screening the patients?
Well, as you have said that we are now looking at India probably overtaking even China in terms of diabetes prevalence as the number one country. It is at present the second. It has the second highest population of diabetes patients in the world, and very importantly, it is estimated that about 50% of the diabetes population is undetected, lying undetected. That is very important because most of the diabetes patients, where type 2 diabetes is the most common type of diabetes, do not have any symptoms, they are asymptomatic. And what happens is we need to actively screen them because we need to prevent the complications, because a lot of patients even come to us with complications once the complications have developed. So which are the set of patients we need to screen? That we must decide first, because an ideal thing would be universal screening, everybody should be screened. But for most important thing is age. Generally, internationally, it is about 45 years, it is the cutoff. Here, there is disagreement, but we have earlier onset diabetes. So probably 30 would be a good age to start off. Again, important factors is obesity. If there is an obesity, if the patient is obese or had a previous or overweight also, then the patient should be screened. The person should be screened. And if there is any presence of cardiac disease, ischemic heart disease, hypertension, dyslipidemia, or any family history of diabetes, or history of diabetes during pregnancy in a mother. So that also needs regular screening as well. And specifically, if there are special ailments like, polycystic ovarian disease, that is also an important factor. If a lady suffers from polycystic ovarian disease, also she should be screened. And for children also, very important, if the children are obese, overweight, and if they have what we call acanthosis nigricans, that is darkish coloration in the neck, that is known as acanthosis nigricans, and polycystic ovarian disease. In those children also, even if they are more than 10 years, they should be screened for diabetes. And with regards to how we should be screening it, it is very important to recognize that in an asymptomatic patient, one should do a fasting. Fasting means 8 to 14 hours of fasting, and the patient can of course have water. And the other test is oral glucose tolerance test. After fasting, you give 75 grams of glucose and check 2 hours blood glucose. And there is another entity called HbA1c, which is a 3 months average. That is how you need to check. The fasting, normal fasting glucose is less than 100. The pre-diabetes is between 100 to 125, and diabetes is more than 126. 2 hours normal is PP is less than 140, is less than between 140 to 200. It is 140 to 199. It is pre-diabetes, and anything more than equal to 200 is diabetes. But of course, if a patient is not having diabetes related symptoms like excessive urination, thirst, then you have to confirm on a second day. You need at least 2 tests before you can stamp a patient as diabetes, having diabetes.
So as you said about complications, we'll come to it later. We'll move on to Dr. Siddhartha Mani. Sir, as a cardiologist, what are the most dreadful situations that you have faced while treating the general population, especially in our hospital?
Okay, so as a cardiologist, the two most important disease entity which we face every day in our practice, and they are most serious as well as dreadful also. Number one will be heart attacks and ischemic heart disease as a bulk, and number two is heart failure. Now these two diseases are most important because they are chronic, long-standing diseases. The patients suffer a lot from these two. They require recurrent hospitalizations or often interventions like angioplasties or special devices. And number three is, most importantly, they have a long subclinical phase where the patients often have very subtle symptoms or no symptoms at all. So the patients ignore those symptoms and they present to us late and in a stage where we are already facing complications. Apart from this, the other patients that we see day in and day out, number one is hypertensive patients, high blood cholesterol, having other risk factors, having lifestyle related issues. And then there is a big set of patients having valve diseases like the rheumatic heart diseases, having mitral stenosis, mitral regurgitation, aortic valve diseases, age-related calcific aortic valve diseases, which often require balloon interventions or open heart surgeries and valve replacements. And then we also have a set of arrhythmic patients where the heart rates often goes to very significantly low levels, where we implant pacemakers, or their heart rate can be very high also, leading to sudden syncope or cardiac arrest, where we often require electrophysiological therapies and interventions, and medicines as well as other devices are also there. So largely the most important focus of us will be to treat or to detect this ischemic heart disease and the heart failure patients so that they can have a good quality of life as well as quantity of life.
I'll move on the discussion to Dr. Arindam Biswas. It was difficult to pick up a topic for an internist such as Dr. Arindam Biswas. So I thought of picking up which is the most pertinent one, which is facing the common man, the summer season. So with the advent of the summer season, the physical health as well as the mental health, as we were talking about earlier also, always goes into a disarray. So as a common man, what should we do? And as a doctor, what is your advice to the common man?
Well, first, thank you for inviting me into the panel. And I would like to highlight on issues that is confronted by a physician on several ways. Now, as a internist, what kind of problems I see every time when as a doctor. Now, a patient comes with viral fever. A fever is what I'm going to say is a Waterloo. It's very difficult to identify what exactly is the cause of fever. Now, fever can be due to viral, fever can be due to bacterial. It's very difficult to decipher from the word fever. Now, first we have to understand what exactly is fever. Now, fever is something when the AM and the PM temperature, there is a difference of 1 degree Fahrenheit. Then only we can stamp it as a case of fever. Now, we can feel chills, we may not have fever. But fever is something that confronts us every day, and this is a big problem, big issue. Viral fever is very common, and for that there is a rampant misuse of antibiotics, as you know. Every internist, and this is a major problem India is facing, antibiotic resistance because of overuse and misuse of antibiotics. Now, viral fever is one. Now, the second problem which I face is abdominal pain. Now, abdominal pain is there are a variety of causes, from serious issue to a very non-serious one. In summer, this abdominal pain mostly is caused by a condition called muscle cramp, heat cramps. In summer, there are three things that we encounter commonly. One is heat exhaustion. While people sweat, people may feel dizzy, disoriented. This is simple heat exhaustion. If they're replenished, if someone is replenished with proper minerals, proper fluids, this problem will go very soon. The problem is heat cramps. Now, what happens especially in muscles, in the arms, in the calves, in abdomen, patient may present with abdominal pain. Now, we have to judge very meticulously what exactly is the cause. But in most of the cases are due to abdominal cramps, and for that fluid is necessary. This very serious issue in summer is heat stroke. In India, though in Calcutta, where I belong to, it is less. But in other parts of India, it is a major problem. We can see unfortunate incidents happening every day. People are being killed by heat waves. This is heat stroke. When we are subjected to a kind of work where we are not habituated, we are doing excess work in the summer and our body is not habituated and we are not sweating it out at the proper time and sweat is not produced properly. In that case, there is excessive heat production and ultimately can disturb the entire brain as well as the muscle apparatus, resulting in a death. So we have to be very careful. These are the small issues. Now we can have a parasite like malaria. This is the beginning of the danger season. Malaria, dengue. We can have skin rashes. That is another problem. People coming that we are getting this, our skin is getting discolored. So these are the issues as a doctor in summer we face, and dehydration. And now I would like to highlight one issue about it was discussed by Debmalya. Dr. Sanyal, one thing is very clear about childhood obesity. Now everybody has a habit of eating processed food, which we call junk, though wrongfully. Wrongfully we call it junk. It is a processed food that we eat. And childhood obesity, I think it's a major problem in India now. Between 9 and 11, I think we should tackle what is your opinion?
Yes, I think this is a very important issue which you have actually pointed out and which I had just mentioned briefly. And probably this is the major cause of rising obesity and even cardiac issues which we are facing at a very young age, having ischemic heart disease at 25, 30 years. And because the whole problem is that once a child gains weight excessively, then all the facets of obesity comes in. That is, along with diabetes, you have lipid problem, you have early hypertension, and you have already early heart disease also like ischemic heart disease. And so the major impact which we can have is by a policy where it cannot be only at the level of the doctors. We are seeing the end result. We have to address it as a policy where the level of physical activity has to increase significantly, where there are some states in the world where they've imposed taxes on this what we call junk food, where we should be very careful allowing these introduction of these kind of food. And also school probably has the biggest role. School health programs, we have done school health surveys as well as school health programs, and they have probably the biggest role in terms of awareness, creation of awareness, screening, as well as with regards to advice, where some schools have taken up with regards to what kind of tiffin is healthy. Then regularity of exercise, something which has to be stressed over and over again. Overburdening the children with studies only without any scope for exercise is very bad. So if that is not tackled, the problem is once obesity develops, it's very difficult to treat because there are very few effective medications to reduce obesity. So you actually go on treating the complications of obesity rather than obesity per se. So prevention obesity is very important. And for that, awareness at the level of society, at the level of individual in terms of parents, and also at the level of the school and government has to be stressed.
Coming to Dr. Siddhartha Mani again, as you had mentioned the two terms heart failure and heart attacks, which seems very synonymous to the common man. Can you just elaborate on the two terms and discuss what the two terms are and how different they are?
Exactly. As you said, the terms look very similar to the common people. See, first of all, our heart is a muscular organ with few sacs where the blood is constantly filling and the heart is pumping and the blood is getting out. So our heart is basically contracting like this and relaxing in every cycle. So, and these heart muscles are supplied by 3 coronary arteries which are constantly giving blood to the heart. Now, once a patient develops a block in the coronary artery, what happens is the blood supply to a particular segment of the heart is jeopardized, and hence those muscles are not working properly or not contracting properly. Now, when an artery gets totally 100% blocked, the portion of the muscles are dead and the patient suffers from a heart attack. This is basically what we know as heart attack, and sometimes the patient gets preliminary symptoms which I can discuss, like angina or exertional chest pains. And often when a patient does not have any preliminary chest pain symptoms, they can present all of a sudden with a severe massive chest pain with sweating, shortness of breath, unconsciousness and all sort of complications, and that can be a heart attack. Now, heart failure is a slightly different thing. Heart failure is when the heart is unable to pump adequately or relax adequately. Our heart is pumping, contracting like this and relaxing like this. Now, any of this process when gets jeopardized because of muscle disease or lack of blood supply or anything, in that scenario, the heart is unable to pump adequate blood. So there is lack of blood supply to the kidneys, to the brains or to the other organs of the body. And this blood accumulates in the lungs, giving rise to pulmonary edema and shortness of breath and other difficulty in breathing. So this is basically heart failure. And these two entities are more or less a part of the spectrum. Like a patient suffering from a heart attack will have a compromised heart function, and over subsequent times he will develop inadequate pumping, and that will lead to heart failure, that will lead to renal problems, that will lead to other symptoms and complications. So this is the difference between heart attack and heart failure.
Thank you, sir. So coming to Dr. Biswas, sir, as you mentioned, malaria, dengue and other viral fevers that hits us during the summer season. Sir, can you please elaborate that what a common man can do to prevent this, and what are the red flag signs when the patient should come to us immediately?
Yes, this is a good question, that that we should be careful, and we as doctors should not create a panic. First of all, my clear message: we should not press the panic button. We have to be very careful. We have to send the proper message to the people so they don't get panic and there is a hullabaloo, there is a ruckus created when such disease occurs. Now, what about malaria? Malaria, you know, this is happening for a long time. Now, this is caused by a parasite. It's a plasmodium. Now, it can be severe, it can be mild, but I would like to reassure you that malaria is treatable, and if diagnosed early, patient will recover. Now, how it presents, as you say. Now, actually, if you go by the book, it presents with chill, rigor, but this used to happen when paracetamol was not, was very easily available, neither other antibiotics nor other medications. So classical description may not be present in a patient, but we have to think when a patient is presenting with high fever, vomiting, chills, we have to think about malaria. This is one, but I told you at the outset that it's very difficult to decipher between a viral, bacterial or a parasite, because we use medicines at the earliest stage, but we do not go to a doctor. Unfortunately, most of the medicines are prescribed at the initial stage by the shops, which should be prevented under any circumstances. Now, number two, as we see a malaria case, we have, as a doctor, as a clinician, I have to explain. Now, you go for the blood test at the earliest possible time. Don't delay. There should not be any room for procrastination. You get the blood test, but mind you, malaria may not be positive in the first case. In the first instance, we might have to take repeated blood test. But if there is a doubt, if you see there is an organ called spleen on the left side of the body, if we see that spleen is palpable, and the fever is more or less matching with the signs and symptoms of malaria, then we can think of starting a treatment. We should not waste any time. Let us go for 3 or 4 blood tests. Now, antigen tests are available instead of peripheral blood tests. These are very sensitive and specific tests. Now, coming to the point, now we have to reassure the patient. We should not create a panic. There are medicines, first oral medications, but as you know, there is a medicine called chloroquine. Now, chloroquine resistance is growing by the day. We have to identify the patient which one is resistant to chloroquine. If the fever doesn't disappear within 48 hours after chloroquine, then we have to go for some other medications, maybe parenteral. Now, quinine is not effective nowadays, and it is a cardiotoxic medication. Now, there is a medication called artesunate. You can give it safely, and it's very safe in pregnancy too. So this is how you can get rid of malaria. Coming to dengue.
Yes.
Now again, there is a big ruckus when this issue is discussed because there is an unnecessary panic button is pressed at the time, at the dengue season. You require platelet. The first thing you hear about dengue is platelet. Well, dengue may be severe, but only in a fraction of cases dengue turns severe. Mind you, dengue turns severe when there is a comorbid condition, when the immunity is suppressed. Now, what do you mean by suppressed immunity? Patient could be diabetic, patient could be suffering from cardiac failure, patient may have undergone bypass surgery, patient is on steroid therapy, patient on cancer chemotherapy. These are the type of patients who develop sepsis very easily. There is concurrent sepsis associated with dengue often. That is where we have to be very careful. I have to highlight that issue. But getting a patient admitted at the first instance when we diagnose a case of dengue is something very unfortunate. We should avoid that. And platelet, we have to be very, very careful about the platelet scenario. If it is less than 30,000 with presentation of bleeding, then only we admit the patient. We give platelet. Prophylactic platelet plays no role. And in fact, it's counterproductive for the patient. This is in short, I would like to highlight that we can treat the disease. Dengue has no specific treatment, but if we are vigilant from the day one with the patient, I think that problem can be solved and solved at the earliest.
Thank you, sir. Moving on to Debmalya Sanyal, sir, again. Coming to the diabetic complications that you were talking about, you talked about obesity. What are the other complications that the doctor should be afraid of, and what are the ways that we can prevent them on both the sides, on the patient as well as the doctor?
Yes, one of the important issues which we find with diabetes is its long-term complications, especially with, you have small vessels in our body and we have large vessels in our body. The one is with regards to it affects the eyes. People come and say that, I have checked my power and, cataract, I have got my cataract operated, so I don't have any diabetes problem. So, yes, diabetes can cause changes in the refraction, that is power, and also it can lead to early cataract formation. But a major part of diabetes complications is related to its retinopathy, that is the retina, and where it has to be screened even if the patient is asymptomatic every year, because the patient can develop sudden bleeding and then it is far too advanced. So that's very important.
How many years of diagnosis?
So for type 2 diabetes, you have to start screening from the word go from the time of detection, because the patient may be undetected for years together. For type 1, which occurs in young patients, you screen after 5 years. Then you can develop nephropathy, which is kidney, and the commonest cause of renal failure worldwide is basically diabetes. And so the way you need to prevent is by good monitoring, especially with regards to your blood pressure, your blood sugar, as well as your lipids. So if those factors are well controlled and regularly monitored and regular treatment is up-titrated, then you can prevent nephropathy. And very important in terms of nephropathy prevention, probably the most important role is hypertension, blood pressure management. That's very important. That is something which is forgotten, and a lot of patients actually forget that aspect. And with regards to neuropathy, which is again, patients have tingling, numbness in their feet and burning sensation, which is quite a painful condition. Again, to some extent it is preventable, but to some extent it is not, because it is also related with the duration of diabetes as well as, and with the degree of its control as well. So to prevent all these, we need to have regular monitoring and regular adjustment of therapy. And once neuropathy develops, there is increased chance of foot ulcer, because the patient cannot feel pain, and sometimes the patient can come with a prick or even with a burn where the patient cannot feel pain. And the other complications are, with regards to the big vessels, like, heart attack, myocardial infarction, and stroke, which is very important, because which already has been discussed, myocardial infarction. And stroke is also a very important component as well. And another important component which is quite neglected is peripheral arterial disease, where you can have pain during walking, and you can develop foot ulcer and even require amputation. This is something which is even more common, just like in heart attack and stroke, even in patients where they have associated smoking or tobacco, intake of tobacco. Along with diabetes, they must control the blood pressure, and very importantly also control the lipid profile. A lot of patients we see when we prescribe lipid statins, which are a major medicine for lipid profile, they discontinue after a point of time because they feel that there's no valid reason to prescribe it. But that has a preventive role in terms of cardiovascular risks like myocardial infarction or heart attack and stroke.
Basically, it's a multidisciplinary
approach, and it has to start early. It, once 10 years down the line, when everything has been damaged, then treating at that point of time hardly can make any difference. So you have to start early and be aggressive in your management early on from the start. What go?
Okay. Just carrying on the discussion, as sir was talking about acute myocardial infarction, we have patients with chest pains. So sir, according to you, are all chest pains serious? And when should a patient be very afraid that he is having a cardiac chest pain?
This is a very useful question because often we see that patients had a history of chest pain. They thought it was due to acidity or some gas related issues, and they neglected. They took some pantoprazole or Rantac, and then they land up with a heart failure and come to us maybe a few months or few years even later, and we find that yes, that patient had already had a heart attack long back. So this is because patients are not very sure which chest pain is cardiac and which chest pain is non-cardiac. So most importantly, chest pain which is exertional, that is which is associated with some exertional activity like walking fast or walking upstairs or walking after heavy meals in an early cold morning or patient running or cycling. So doing some heavy activity as well as also mental exertion sometimes plays a role, because patients, when they are agitated or when they are very excited about something, if at that time patient feels any chest pain or chest heaviness, that is most important. Now, this pain usually relieves on taking rest. This is also one important factor, or giving some nitrate group of medicines, which is commonly called sorbitrate. Patients already know. They put a sorbitrate below the tongue and the pain gets gradually relieved. So this is basically cardiac in nature, or which we call angina. And sometimes the patient do not give any such symptoms, do not have history of any chest heaviness. All of a sudden, they develop a severe chest pain, mostly central, often radiating to the left arm or up to the neck or the lower jaw. And this pain is often associated with sweating, shortness of breath, which is very important. Patient feels a choking sensation, a sense of doom. And often it is complicated like with loss of consciousness or any other serious situations. So if a patient ever feels a severe chest pain which is persisting for more than say 5 minutes and not relieving with just simple rest, it should be considered as a heart attack. And the patient should rush to an emergency, do an ECG, do some troponins, and then assure the diagnosis. If it is seen non-cardiac, then the patient can come back. But I will advise that each and every patient feeling a severe chest pain persisting for more than 5 minutes should immediately go to an emergency. And this is most important. Otherwise, there are other causes of chest pain also, like acidity itself or reflux disease. Gastroesophageal reflux can cause chest pain. There are certain musculoskeletal diseases like costochondritis is very important in females, especially the rib cartilages, they have inflammation and chest pain. Or sometimes spondylitis and spinal cord problems. That back pain can also be referred into the front part of the chest and misguided as angina chest pain.
Coming back to the summer season with Dr. Biswas, so what are the lifestyle modifications that we should do to avoid the problems that we generally have during this season?
The first question that comes to mind is what you are going to eat. Eat plenty of fruits and vegetables. They carry water, that is supplying water to the body. Your dehydration that dehydration problem can be solved. You will not be dehydrated. Number 2, regarding clothing, linen and cotton. This because they have pores in the body, so it's very easy for the sweat to move out and keep your body cool. Number 3, don't overwork. Don't resort to excessive work if you are unaccustomed. Try to stay indoors or stay under a shade so that you are away from the sunlight. And if you are exposed to sunlight, use a sun protective cream that is very easily available throughout India. Use those protective factor scheme, high protective factor skin cream, so that it prevents tanning as well as rashes, because such rashes can result in itching, and ultimately if you keep on itching, there could be a possibility of cellulitis that needs to be prevented. And especially as Dr. Sanyal and Dr. Mani had said about diabetes, and diabetes patient can develop cellulitis. Now, again, if you take a walk in the morning. Don't take a walk when the sun is there. Underneath the sun, you need to avoid, because you are not, especially the children and the aged patients. They have to be very careful, because their body is not accustomed to sudden change. They cannot adapt. In that case, they fall ill very easily. They can have heat stroke even if they are non-ambulatory. Mind you, heat stroke can happen in non-ambulatory patients also. It's not that. And you have to, if you are on any anti-allergic medications, if you are on any antidepressant, you have to talk to your doctor, because they can result in dryness of the skin. That can be very harmful during summer season. And number two, another point that I would like to highlight, we have discussed about diabetes, we have discussed about myocardial infarction, and people have become wiser on the other side of the camera. Now, I believe thyroid management is another important. I can see patient as an internist stopping thyroid medications without a rhyme or reason after TSH getting normalized. I will ask Dr. Sanyal to tell us about the danger of stopping thyroid medications abruptly.
Thank you, and also for focusing on thyroid part of it. Because one is, the thyroid hormone, where the thyroid hormone is excessively secreted, that is known as thyrotoxicosis, where you have excessive thyroid hormone, weight loss, palpitation. Though it's a rarer form of thyroid disease, but it still affects about 2 to 5% of the population. The problem is, if you suddenly stop those medications, once your TSH is normalized or your thyroid function is normalized, then again the thyroid, whether it is hypothyroid, that is lower, that is the thyroid gland is not functioning properly, or excessive functioning, that is hyperthyroid, either way it can be dangerous. One is with regards to hyperthyroidism, then the patient can suddenly again go back to weight loss, palpitation, that's very important from the cardiac point of view, like you can have dangerous arrhythmias which can lead up to cardiac problems, even myocardial infarction. And also there can be fractures in limbs, because that can lead to osteoporosis. And on the other side, if you have hypothyroidism, severe hypothyroidism, people stopping, receiving high doses of thyroid, then they are normal. Then they suddenly stop it. The problem is, because the thyroid drugs have a long duration of action, they will not feel the difference immediately. It will take about 2 to 3 weeks for the differences to come in. And especially in hypothyroid, the patients can become weak, lethargic, and drowsy. And some point of time, they can even become comatose because of significant hypothyroidism, what is known as myxedema coma. They can have cardiac problems like pericardial effusion, where fluid accumulates in the heart. And also it has been seen that hypothyroidism is associated with cardiovascular events and cardiovascular disease as well. So just like thyroid medications, as has been said, should not be started overboard, as Dr. Arindam Biswas has said, that any medication should not be started without a doctor's prescription. Similarly, thyroid medication should not be started, and they also should not be stopped just without seeing a doctor, without seeking a doctor's advice whether it is proper to stop a thyroid medication or not, because that can have significant dangerous consequences.
Sir, a few words on hypoglycemia also, as we were discussing diabetes earlier.
Yes.
While we are treating diabetes, very fearful consequences, hypoglycemia. What are the signs and symptoms, sir, in a few words, and how can we prevent it?
Yes, especially, we are coming towards one of the religious festivals, that is Ramzan, very soon, and there is a long period of fasting, and that is one of the significant risk factors for hypoglycemia, where the sugars actually go down. The criteria is less than 70 blood glucose, 70 milligrams per DL, where the patients have sweating, palpitation, tremor. Then if it is not corrected, these are warning signs. Then if it is not corrected, then the patient can go into drowsiness, weakness, coma, and convulsion. So one should prevent those serious consequences. And the patients, especially those who are diabetic, and they are taking diabetes medications like insulin, they should be careful. they should be careful, especially with regards to their food intake. Their quantity of food intake should not vary, especially the carbohydrate intake. The timing of food should not vary. They should not skip meal. And also excessive exercises, like in summer months also, if you have excessive exercises, that can cause hypoglycemia. Another thing which happens quite commonly, if you have excess food, then there is a tendency to consume excess doses of insulin, take excess doses of insulin or excess medication. That should not be done, because then also the patient can develop significant hypoglycemia. And if a patient has hypoglycemia like these symptoms, they can immediately address like 3 teaspoons of glucose or any fruit juice. Along with that, they must have any solid carbohydrate, like either biscuits or a piece of bread or early meal. Why? Because glucose and sweets only will cover it temporarily. To prevent a recurrence of hypoglycemia, they must take a complex carbohydrate. That is very important. But if the patient becomes drowsy, don't try to force glucose into their mouth. Go to the hospital, admit the patient, or give a dextrose saline in the hospital, rather than giving any glucose drink in a drowsy patient, and that can lead to aspiration and dangerous consequences.
Now, to sum up our panel discussion, I'll ask Dr. Siddhartha Mani as well as Dr. Biswas that what are the general precautionary measures that a general person on the street should take to avoid all the problems that we have discussed all through our discussion.
Exactly. See, from cardiac point of view, we have certain risk factors which has to be diagnosed and treated early. That is most important. Diagnose, as Dr. Sanyal said, screen for diabetes, diagnose diabetes early so that you can prevent a myocardial infarction maybe 10 years later. So accordingly, you also diagnose hypertension, high blood cholesterol, and you treat them accordingly. Next, most important, as Dr. Biswas was telling, was lifestyle modifications, that is healthy food and dietary habits. So we need to stress on decreasing our carbohydrate and fat intake. We need to stress more on vegetables, fruits and dietary fibers. And we need to stop fast foods and junk foods as much as possible, control our obesity, and very importantly, addictions is most important, because cigarette smoking is the worst risk factor for these cardiac diseases. So you have to stop smoking completely, and also you have to restrict on your alcohol intake or any other drug abuses, like in young generation sometimes we find cocaine abuse and other things which are deadly for the coronary arteries. So these addiction habits has to be changed. And then exercises, regular exercises is always important. We advise at least 45 minutes of exercise or brisk walking at least 5 days a week, which is important for cardiac, diabetic, obesity and all points of view. So these are probably the most important prevention measures by which we can control our modifiable risk factors.
Sir, anything that you would like to add upon?
Yes, especially about the diet, I would like to highlight. There are places, there are food items where there are lots of trans fat. Trans fat, as you know, is a particular form of fat which increases the shelf life. But whenever it is taken with relentless regularity, it can cause heart problems. It can cause heart attacks at any point of time. Now, number two, whenever, which you call junk, I call processed. It's not junk, it's processed. You are going to a shop, they are processing it by using proper oils so that it increases the shelf life, and ultimately it is presented in such a way that you cannot stay away from eating. You have to control your, you have to solve your hunger, but you have to control your emotions.
So in this regard, I will just add one thing for the viewers. As sir very importantly mentioned, trans fats. We have to remember that trans fats arises from recooking of oils. The more number of times we are recooking a oil, just like an egg roll shop, it is cooking the egg roll in that same oil repeatedly. And as the number of repetitions increases, the trans fat percentage also increases.
Absolutely.
And another most important thing is, remember that any oil which is solid at room temperature contains a very high content of saturated as well as trans fats. So if you suppose you are doing a butter spread on the bread, so you prefer liquid margarine rather than solid margarine, because anything that is liquid has a lesser percentage of saturated fat or trans fat.
Actually, you require 20 grams of saturated fat daily.
Exactly.
And you require possibly 300 milligram of cholesterol
per
daily.
Exactly.
That is the reason when
How does it translate to a common man? A common man cannot understand 20 grams.
No, 20 grams means it's very simple. What you are eating, it's coming from the diet.
Exactly.
You
If you
are
avoid
eating.
those processed foods and oil
For
rich
example,
foods,
if you eat
will
paneer,
get to that 10 or 20%.
For example, if you eat paneer, you are getting saturated fats. If you are eating cheese, you are getting fat. But whatever you eat should be in restricted amount so that you don't hurt your body.
That is
That
also
is the
very important
ultimate
from diabetes
message.
point
You
of
don't
view.
hurt your body. You have to prevent in order to avoid excessive and excessively costly restoratives.
Thank you, sir. I think we have come to an end of a very fruitful discussion here at NH Tagore Hospital, Kolkata. So the take-home message for my viewers is, I think that my sirs would also agree that lifestyle modifications, sticking to the doctor's advice, and not over prescription of drugs over the counter is the take-home message that we want to deliver. And at any time, if things go disarray, we are here to serve you.
Thank you
so much.